quick educational segment just about anti-inflammatories, because I always forget to talk about this or post on this. And I was just doing consults on FaceTime and I'm late, so I got to do this quickly. So anti-inflammatories in general, some of them are a bit poorly understood as to what they do for surgery. In general, anti-inflammatory supplements and pills and things like that are good for your health, for your heart, and they can thin your blood in a very nice, natural way. And they can also decrease inflammation in your joints. So it's great for normal life. However, if you're going through surgery, that's not normal life. That's like kind of getting into a car accident and your arm getting ripped off and you're going to bleed. You want to decrease the chance of bleeding during those incidents. One of those incidents is surgery. Surgery is a traumatic incident that you're going to have to go through. And we try to limit blood loss as much as possible because blood loss, although not dangerous for the most part when you're doing facial surgeries, it can be, but it's very rare. It's more of a nuisance for healing. You get blood deposition in the skin and the blood has to be broken down to heme products, hemosiderin and things like that. And those are inflammatory to your skin. So you try to diminish that and your healing goes faster. You also decrease risk of hematoma, blood collection under the skin. So the supplements that we see, the number one I'm going to talk about that we see in California, Los Angeles, more than the rest of the world is turmeric. I will tell you, in my opinion, it's fact. But so it's 60% of the time, every time. But in my opinion, this is fact that turmeric is a very strong anti-inflammatory supplement. And it's a very real one. It's not like some people say and they're wishy-washy about like maybe fish oils, maybe vitamin E, maybe ginkgo, maybe those things. Turmeric is not a maybe. Turmeric is a definite. And if you're a surgeon in LA, you know that because our patients bleed when they're on turmeric. In LA, everybody is green and healthy and they love shakes and supplements and taking anything healthy. So turmeric is one of those things. Turmeric has active products, byproducts, or components in them called curcumin. Curcumin is the same kind of thing. Cayenne pepper is a different pepper, but similar. So turmeric, curcumin, cayenne are the three that I always mention to patients. Please do not take those at least 2 weeks. I would take a break from those things, minimum. Just like aspirin, you want to take a break for 10 days. So aspirin, ibuprofen, naproxen, NSAIDs, non-steroidal anti-inflammatory drugs. You want to stop those about 10 days before. Turmeric, 2 weeks before. It kind of somehow sticks around in the system and keeps people with thin blood for a long time, and they really, really bleed more. If that happens, what do? In the operating room, we give TXA, tranexamic acid. Tranexamic acid, we can put into the solution of the injection that we're putting, and it actually does work pretty well that way. It makes the blood that comes out, it gives it a little syrupy kind of texture. You'll notice that. Otherwise, you can give it IV, and it does the same thing. So TXA is a lifesaver in those situations. And then we clean off the field when it bleeds with bleach, with a Dakin solution, which is excellent for hemolyzing blood that kind of stayed in there so it doesn't stain into the tissues. So it's a wonderful thing to use. Other anti-inflammatory supplements, arnica and bromelain, undecided. Nobody knows if those cause more bleeding, more bruising or not. It is generally thought to diminish the duration of bruising afterwards and duration of inflammation. Bromelain is a pineapple core supplement or a derivative, and things like arnica come from like sunflowers. So they do help overall afterwards, but for most people, if you don't want to take any risk, don't take it before because we don't know. So definitely no turmeric before, but turmeric you can take after, maybe 3-4 days after or a week after. Listen to whatever your doctor says and it's wonderful. And the other ones are kind of basic. I would say if you're on multivitamins are great, but you don't need them around surgery time. So just cut out everything that could make you bleed before you do any kind of surgery. Things like CBD have not been shown to have any increase in bleeding potential, but there's no reason to take it beforehand either. It can be wonderful afterwards when you take CBD supplements because it can, depending on which supplement, whether it's hemp-based or not, or from, which part of the cannabis family it's in, you have to figure out. But some of them make you more mellow, just like Valium would, where it diminishes the threshold of pain or increases the threshold of pain. And some of them actually diminish the pain. So it gives an analgesic effect. So CBD can be a wonderful supplement. And a lot of patients like to use CBD, turmeric, and everything afterwards. And they really, really work nicely. So I'd say watch out for those things. Remember, if you're undergoing a surgery, I know you want to be healthy later. Don't be healthy right before the surgery. The only thing that you can take that people think helps is vitamin C. And that's based upon what we saw in pirates. Pirates have scurvy when they have no vitamin C, because vitamin C is the cofactor for collagen cross-linking. It's really not for your immune system so much. People use it in high doses in ICUs for different things, but vitamin C, it's a myth that it helps your immune system. It does not help your immune system. It's a cofactor for collagen cross-linking. But you can take that because you're going to be forming collagen afterwards. But if you're not a pirate with scurvy, likely you'd be fine without it if you have a normal diet. So that's all. My sister called me a nerd, obviously. And everybody have a good night. And I'll post this right now. Hopefully it helps. And please don't take turmeric if I'm operating on you.